family caregivers, those unsung heroes among us who selflessly sacrifice their time, financial resources, and their lifestyle to care for a loved one. Nearly 66 million people nationwide and 358,000 here in central Indiana alone provide care for an elderly or disabled family member. Locally, that represents more than $2.4 billion in uncompensated service. In reality, caregivers' contributions are invaluable because they allow individuals to stay in their homes and live more independent lives. However, this service is not without its own costs, often to the health and well-being of the caregiver. I am pleased that we have an expert from the medical community to share his insights in becoming an effective caregiver for your loved one. Dr. Malaz Boustani is the medical director of the Wishart Health Services Healthy Aging Brain Center and the chief research officer of the Indianapolis Discovery Network for Dementia. Dr. Boustani is pioneering the Aging Brain Care Model, which uses a team approach to improve the quality of life and health outcomes of dementia patients. In addition to the Aging Brain Care Model, extends traditional patient care to include the family caregiver. Dr. Boustani received his MD from Damascus University in Damascus, Syria, and a Master of Public Health degree from the University of North Carolina, where he also completed a fellowship in geriatric medicine, and he is a member of the CICOA Foundation Board of Trustees. Please give a warm welcome this morning to Dr. Boustani.
Good morning. So you can tell I'm not a traditional doctor for a couple of things. I take care of your brains, and not just your brain, your loved one brains too. One thing, don't ask me any question below the neck. I'm not a good source of information. All right. How many of you guys are caregivers for loved one? Raise your hand. All right. So not many of you. Those who have not raised your hand, you're going to become a caregiver over the next decade or so, and CICOA will take care of you, and not just your loved ones. So this is one of the reasons why you need to help CICOA. It's very selfish reason, so we can take care of you guys. So let me give you a very quick information that you can take with you home and be ready when you become a caregiver. So this is the definition of caregiving for me. It's any unprofessional, primarily informal person, most of the time our family, and who really provide constant 24/7 support for their loved one, and not just physical support, financial support, but also emotional support. So this is how I define a caregiver. Here's the fact. Julie have already shared with you a couple of facts, but 1 out of 5 of you guys right now are a caregiver for a loved one with some type of disability, physical or psychological disability. For long-term care, 90% of long-term care is actually provided by family caregivers. So my wife, father and mother are in long-term care, and we provide really the majority of long-term care for them, not the government or the insurance. It's primarily the 3 daughters of my father and mother-in-law. A usual caregiver will spend every year close to $5,500 out-of-pocket expenses for you. So those of you guys who are not caregivers, start saving money when you become a caregiver. This is going to be completely out of your own pocket serving. And when you become a caregiver, you're going to become a patient because of the following. Number one, you're going to struggle having time for your own. You're going to be completely sandwiched between caring for your loved one. Sometimes it will be your family members like father and mother, and sometimes your kids. You're going to have a hard time managing really the stress, the physical stress of caregiving and the emotional stress, and you're going to struggle balancing work and family, especially if you decide to work forever, like I would recommend for you to keep your brain healthy. The last thing I want to let you know, we look at you in our Healthy Aging Brain Center as a caregiver because you are, as a patient, because you are in fact a patient. Just because your role as a caregiver, every year you will visit 21% of the time, 20% of you guys will visit the emergency room at least once every year, and 11% of you will end up being hospitalized at least once every year because of your role as a caregiver. So this is a real a challenge. And a typical caregiver at this time, that this might change in the next a decade or so, but a typical caregiver is a woman who's in her mid-40s, who has some college education. She usually cares for her mother. Now, in the future, that might change. And she, on average, provides 20 hours a week of unpaid caregiving. 20 hours a week of unpaid caregiving. So that's the typical caregiver in the United States in 2013. Now, in our Healthy Aging Brain Center, because we do a lot of research, we already discovered that when patients with dementia come over to our center, really the issue of patient, who is patient, who's not, it's not relevant. In our eyes, there's two patients, the care recipient, or the person who suffered from dementia, and the family member who provide a lot of emotional, physical, and psychological and financial support for them. And then we also realize in the Healthy Aging Brain Center, especially the caregiver, is we're gonna have to provide support for that caregiver, not just when she sees me for that 15 minutes every 3 or 6 months. It's a lot of caregiving will actually happen between the visit, so we have to provide that one. And then we have one big thing in the Healthy Aging Brain Center that we kind of share with our family member. We tell them that we're gonna be on your journey bus for quite some time, and you're not gonna be able to get rid of us very easily. You're gonna have to fire us 3 times in a row until I will officially tell my team, all right, get off the bus. They don't want us to be there. So we were not gonna get off the bus in the first time you say, I don't want you guys are terrible. The last thing I want you to take with you is the following prescriptions that will make sure you have a good, peaceful, stress-free caregiving journey with your loved one. Number one, as you can notice today, not all of you were caregivers, all right? And therefore, you're not certified to become an actual effective caregiver. There will be knowledge acquisitions that you need to obtain to become an effective, stress-free caregiver, and that usually takes time. So we usually give our family members, family caregiver, materials for them to learn, and we check on that knowledge every time they see me. We call that nagging. So I nag at them all the time, you know, like doing their homework. The second thing, there's very specific skill set that we work with our family members, our family caregivers, to obtain over 6 months, sometimes 12 months. Number one is problem solving. So we teach them how to do problem solving. We teach them how to cope with different kind of strategy to cope. And we try to really give them resources on relieving their stress. One of my one of my patients' caregiver, her stress relief was on Sunday, a spa for 4 hours in her bath, where she really have aromatherapy and very nice relaxation. Our struggle with her is 4 hours is not enough. She needs to make it 8 hours. And that's bring us to the major concept, because you're working 20 hours on top of your current work, you're gonna really need to have a Saturday time off. And for us, we did a lot of research. This is not just you know, Malaz perspective. This is research-based. A caregiver, in order for them to become an effective caregiver, they have to take a minimum of 8 hours time off a week off their caregiving job. And that time off cannot be just physically time off, psychologically be time off, and cannot be 1 hour here and 1 hour there. It actually has to be 8 hours. So if you actually split it 1 hour here, 1 hour there, your caregiving stress will go up, because you will have the delusion that you have actually took time off, and you will end up, why am I tired, and you will feel guilty that you're feeling tired, and that's the vicious cycle. The other thing, especially for the caregiver patient with dementia, attending monthly support group with other folks who've been in your journey, maybe before or after, it's going to be very, very crucial. And then for us, we know caregiving will lead to crisis, and we want to make sure, at least in the Healthy Aging Brain Center, that when crisis happen, you are prepared for that crisis. You have already planned. If you follow this prescription, and if your loved one was a person with dementia, then you'll be able to keep your loved one away from assisted living or nursing home by close to 2 years more if you don't follow it. So I don't do this just for the sake, being a nice guy. This isn't financially a good solution for our nation and a good solution for everyone, because I can tell you, I do not want to go to nursing home. I don't want to go send my loved one for nursing home. So therefore, these are tips that are more effective. And FYI, this 19 or 2 years delay of needing to the nursing home is 3 to 4 times more effective than any prescription drug. So this is very, very effective. So I hope you follow my prescription, fill it every month, and I don't get paid by it, so it's really good. So thank you very much, and take care of you.